Imagine the worst headache that you've ever had in your whole life. The worst headache. Multiply that by 1,000 times over. And imagine somebody coming to you and saying, I've got a jackhammer and I have to jackhammer on your head for an hour. And multiply that pain by 1,000 times over. That is the pain that people that are suicidal are feeling. And as much as I can say it to you to get you to understand that level of pain, you can't really get there. If you really could get to that place, you'd be at the same risk they are. But that tells you how much pain they're in, which tells you how much compassion you need to have for them.
NetSmart has partnered with Dan Riedenberg in developing a training that we believe will help care providers better handle the tough questions of dealing with people when they're in an environment where suicide is a possibility.
When you're trying to connect with a patient, you really need to connect with them where they're at. So imagine the suicidal brain. It is around suicide. It is about end of life, death, over. So you need to ask the question at that same level. Be very direct. Ask them the question, are you suicidal? If you just say, just not been doing so well lately, don't feel like you want to keep doing this therapy thing, or not too interested in trying very hard anymore, you're not connecting with where that suicidal brain is. If your gut, your clinical insight is telling you, boy, something different here is going on, that's your whole focus right now. You need to acknowledge the pain. Don't promise that it's going to go away, that it's never going to come back. Help them understand that you can help them get through it, or get them to somebody that can get through it. Their mind is going in 1,000 directions, 1,000 of them, all leading to their death. You need to help direct them toward life, toward being alive. Ask the question. It isn't going to hurt you, and it could save their life.